And again, I can't remember if we talked about it before. Of course, the diaphragm is the dome-shaped muscle, right, between the abdominal and thoracic cavities right there. Right? Diaphragm, again, the dome-shaped muscle separating the thoracic and abdominal cavity, right? That's the diaphragm, okay? All right. So, if we start on the inner thigh, the groin area there, okay? This muscle, we said, are the adductor longus, adductor magnus, and the pectineus, okay? So the adductor longus is this one, okay? Adductor magnus, I know it's hard to see, but it's a muscle underneath it, deep to it. And there's a little muscle just above it. That's a little sliver of that. That's a pectineus, okay? So again, this is the adductor longus. The adductor magnus would be underneath it. And then you can see above it, there's a little, tiny little sliver of a muscle right there. That's a pectineus right there, okay? So again, this is the adductor longus, the groin muscle there. Adductor magnus, you can't really see too well, it's underneath it. And then right above it, there's a tiny sliver of a muscle there. That's your pectineus, okay? All right, so then we said there's a muscle that's on the inside, right? On the medial side, a thin strip. What muscle was that? Gracilis. So that's a gracilis right there. Okay, gracilis right there. Okay, on the medial side, a thin strip. We said the muscle that, the thin strip that goes diagonally across the thigh?
Sartorius.
Sartorius, right? Right there. Okay, that's a sartorius right there. Okay. And then on the lateral aspect, going down and attaching to the iliotibial tract, tensor fascia lata, right? So this is the iliotibial tract. You can see this muscle here is a tensor fascia lata. Okay. So again, this is the iliotibial tract. You can see the tensor fascia lata going into it. Again, iliotibial tract, tensor fascia lata going into it. Okay. You guys in the back see that? Okay. All right. So we talked about the gracilis on the medial side, tensor fascia lata on the lateral side. The one going across is the sartorius. So what are the major muscles in the anterior thigh called?
The quadriceps.
Okay? So the quadriceps, we said the muscle in the middle on the surface, this one here, that's called the what?
Rectus femoris.
Rectus femoris. Okay? And then just medial to it, right there, that's what?
Vastus medialis.
Vastus medialis. And lateral to it here?
Vastus lateralis.
Vastus lateralis. Okay? And then just underneath this, this muscle would be the
Vastus intermedius.
vastus intermedius. Okay? All right, so those are the 4 quadriceps muscles. Okay, let's go to the muscles on the butt area here. You can see, bless you, this muscle on the butt here, what's that?
Gluteus maximus.
Gluteus maximus. Now, if you were to remove the gluteus maximus, you can see this muscle here. That would be the
Gluteus medius.
gluteus medius. Okay, it's underneath and a little bit superior to the gluteus maximus, although there is some overlap of the 2 muscles. You can see a little bit of the gluteus medius there. Okay, a little bit of the gluteus medius there. Okay, so we got gluteus maximus, gluteus medius. Let's talk about the muscles on the back of the thigh. What are those called? Hamstring muscles, right? And what are they?
Biceps
femoris.
Semitendinosus.
Semimembranosus.
Semimembranosus.
Okay. Well, anyways, which one is a more lateral one?
Biceps femoris.
Biceps femoris is the lateral one. Okay? So, this one is a biceps femoris. Okay? And then medially, there's 2 muscles here. there's one on top of the other, okay? So the one on top, semitendinosus, okay? The one underneath it, okay, my fingers are touching the one underneath it, that's what?
Semimembranosus.
Semimembranosus. Okay, can you guys see that? Okay, so again, the hamstring muscle is the lateral one. There's a biceps femoris. Medially, there's two of them, one on top of the other. The one on top is the tendinosus. The one on bottom is the membranosus. Okay. Let's now go down to the lower leg. Okay, the muscle going over the front part, you can see in this one, starting at the tibia, goes across, down to the medial foot. That's the tibialis anterior, or anterior tibialis. Hopefully that's pretty easy to figure, right? It's in front of the tibia, so that's called the tibialis anterior or anterior tibialis. Now, on the side, laterally, remember we said there was a muscle. You can see its tendon wrapping around the lateral malleolus there. Okay, you can see it here, this muscle. You see the tendon wrapping around the lateral malleolus. Right, this muscle going down the tendon wrapping around the lateral malleolus there. So this one is peroneus longus, or you can call it the fibularis longus. It does originate at the fibula, so some people find it easier to remember fibularis longus. Okay? And then in the back are your calf muscles, right? Okay? The more superficial calf muscle, this one is what? Gastrocnemius. Okay? Then you can see deep to it, you can actually remove something like this. And this muscle here, which is deep to it, right? You can see this one is deep to it. That's a what?
Soleus.
That's a soleus. Okay? So, what did I miss? Psoas major pectineus, I did longest I think I've got them all. Did I miss any of them on the review handout? No? Okay, so those are the ones you need to be able to find. Okay, these are typically easier to find than the ones on the forearm. Okay? After the quiz, you'll have a chance to stay longer to look at the models. Again, the models I'll be using for the practical are out here. You got the head models in the back. You got that one eye model. Looking at the last quiz, most of you should probably review the eye model again. Okay. You got some of the chest, a few other chests there. You've got these whole body torsos, which you can see the back. Obviously, these you can actually see the legs as well. Okay. But you've got the full torso models to see the back as well. You've got numerous arm models and numerous leg models. Okay, so again, you know, the easiest way to test is make sure you can recognize and name all the muscles. Have your partner go, okay, what's this muscle? What's that muscle? What's that muscle? What's that one? What's that one? What's that one? Okay, you know, obviously after the quiz, you can stay later to review and go over the models that you want to. Okay, so you guys can go ahead and break in your group. There are